Uh, Thank you, Dr. Satyajit, and thank you, Chitra ma'am, for this wonderful opportunity. So I'm not sure if this panel will be able to tolerate tests for binocular vision and stereopsis suddenly out of the blue, but yes, I will try to make it as simple as possible for the PGs and fellows. So what is binocular vision? It's a state of simultaneous vision when two seeing eyes that occurs when an individual fixes his visual attention on an object of regard. We all know what it is, but how do we test it? So we have learned from Pradeep Sharma sir's book that binocular vision, there are 3 grades. One is simultaneous perception, fusion, and stereopsis. So the algorithm in any strabismus measurement would be, first, the order is vision testing, refraction, and assessment of binocular vision, assessment of strabismus as such, and detailed ophthalmic examination. So we will stick to assessment of binocular vision. So binocular vision, what are the tests we commonly use? See, as with all these OCTs and FFAs and exuberant tests, all we need is a very small set of instruments, very simple. All you have it is in your clinic. So we don't need any extensive, expensive equipments like all these retina people and all the previous speakers have been showing. So very simple equipments, that's all we need. So we basically test binocular vision, tests for fusion and stereopsis commonly before we evaluate the strabismus. So what are the common tests in OPD that we perform? We would have all heard about Worth 4-dot test, Bagolini straited glasses test, red filter test, 4 prism base out test. So how do we do a Worth 4-dot test? It is a test for fusion. So the patient has to wear the full refractive correction. Patient has to be seated at 6 meters to test for central fusion, and for near at 30 centimeters to test for peripheral fusion. So they wear a red-green filter to dissociate the eye, and they are asked to see what they see in the distance chart, the 4 dots. So this is how it is done. It's a very simple test. The patient has to be able to understand you. So as an older child, you're supposed to do this test, not in a very small child. So how do we interpret? So if they see 4 dots, it is either binocular single vision. So either they have no strabismus or strabismus with anomalous retinal correspondence. So if they have a right eye suppressed, all they see is the green dots. If they have a left eye suppressed, all they see is the red dots. And if they have diplopia, they see 5 dots. So the next test for fusion and suppression is Bagolini straited glasses test. So here a point source is converted to a line, and lenses are placed 45 inches and 135 inches from the eye, and each eye perceives oblique lines which are perpendicular to each other. So this is how it is interpreted. Again, if there is a normal BSV, the lines cross with a central circular spot. And if there is an esotropia, the lines are deviated to one side and exotropia to another side. And if there is a suppression, only one eye is seen. And if there is a gap in the middle, then you diagnose a suppression central scotoma. So after image test, again, it's a test for fusion and suppression. It is a highly dissociating test. Each fovea is stimulated with a vertical or a horizontal bright light, and patient is asked to draw the after image, and this is how we interpret. A complete cross means normal fusion. This is a very nice, important test. It has very useful points. It's a 4 prism base out test. So a 4 prism base out 4 prism is placed brace out in one eye, and the eye perceives the image shift. If it's a normal eye with a good vision and no suppression, that eye perceives an image shift and the eye immediately moves, and based on Herring's law, the other eye moves. So you see 2 movements, and then if both eyes are normal, then you see a refixation due to fusion. So this complex of 3 movements, one after the other, means that both eyes are normal. So this detects suppression scotoma in one eye. It can be associated with mild amblyopia and microtropia and no other organic pathology. So that is the situation where we perform this test to diagnose the suppression scotoma. So the next level of binocular vision is the stereopsis, and clinically we test mostly near stereopsis. There are qualitative tests called Lang test and random dot stereogram tests, and quantitative tests which measure the level of stereopsis using Titmus, Randot, Frisbee, and synoptophores. So each test has advantages and some loopholes. So random dots are used and cylindrical gratings are used. So there are 2 cards which different levels of different grades of stereopsis can be tested. So this does not require any special glasses, but that disadvantage is they can have a monocular cues. Titmus fly test is a very standard test which we use routinely in clinic. So it uses linear polarization and you need Polaroid glasses to be used to do this test. Housefly, which is seen in the right side of the chart, gives you gross stereopsis. There is set of circles and set of animals. The set of circles you measure 800 to 40 arc seconds and animals measure 400 to 1000 arc seconds. So it's a very standard useful test. This is how you measure. Again, the patient wears the correction and your a good lighting and you're able to do the test. So after you do a sensory evaluation, motor evaluation is to measure the strabismus. So this is again classified into qualitative and quantitative assessment. Qualitative, you do the cover test detecting phorias and tropias, and alternate cover test detecting the deviation. So cover test, we'll quickly go to a small video. So this is a cover test. You cover one eye and see for the other eye movement. If there is a movement, there is tropia. If there is no movement, but either the eye is orthophoric or there is a phoria. So you do the cover test and uncover test and do it for distance and near with a fixation target. So this is test for near. You always use a fixation target and not a torchlight. So this is how you interpret a covered uncover test. You watch the uncovered eye. If there is a movement, it is a phoria or a latent squint. Quantitatively, how do you measure strabismus? You use reflex, corneal reflex tests and prism tests and synaptophore. This is a Hirschberg's test. You see an eye's esotropia. This is a Krimsky test where you use a prism and see the neutralization. Otherwise, the standard, gold standard to measure before you do a surgery is alternate prism cover test. You watch the movement, which either reverses or there is no movement. So this is a measurement of strabismus. The simultaneous prism test measures only the tropia and not the phoria. And finally, ocular motility. So, like I said, it is as simple as that. Thank you. Thank you for your patient hearing.
Thank you, Dr. Kavitha. I think that was a very extensive talk on, it's very lucid for the postgraduates. But
I hope so.
The examination point of view, what to do? I mean, when the student, I think strabismus is one of the toughest that a postgraduate faces. So how does he impress the examiner, and what steps he does or she does in the very beginning to assess the?
See, if I'm an examiner and I get a student and the way they do a cover test, a simple cover test, making the patient sit comfortably, explaining to the patient what they are expected to see and how they use the eye or hand or the occluder to cover the eye probably would impress me. I would have an idea of how they do. And it's not scary as a postgraduate because strabismus is one specialty where you don't really have to memorize a lot of things. There are a lot of clinical skills which are unique to this specialty. And if they learn it along the clinic when they are posted and see everything that the optometrist and the strabismologist does, there is nothing to really fear, sir. It is just a myth that squint is difficult. Thank you.
Thank you for that. Make it, because you made it so lucid and easy for the postgrad. I'm sure they would like to listen to you more.